split spine has no known cause, but it has possible causes. One of them is that the pregnant woman has a lack of folate, or the pregnant woman had a child with spinal bifida, which increases the chances by 4%. The gene that causes it is MTHFR, which provides instructions to make proteins that is involved with the vitamin folate. The test you can get to see if your child has spinal bifida is AFP. It is a simple blood test, just a simple blood test that you take, and it should be taken between 15 and 20 weeks. It depends on what type of person you are for the symptoms for spinal bifida. But like, if you have spina bifida acatola, the symptoms are tufted hair, or a small dimple, or a birthmark. Or if you have meningocele, the membranes around the spinal cord push around through the opening, forming a sac of fluid like on your back. And then if you have myelomeningocele, the spinal cord remains open along several vertebrae in the lower and the middle back, and tissues and the nerves are usually exposed through sometimes the skin, skin. Anyone can give birth to kids with spinal bifida, but if you, like I said before, if you have a child with spinal bifida, you have a 4% chance of having another child. And if you have another child, that child has 4% chance increase of getting it. There's really no known thing to what causes it, but scientists suspect that nutritional and mental genetic factors play a part of it. During your childhood, you may need aid. Children really do rarely need aid. They really do well, but like, if you need aid, you don't need aid because you have difficulties like remembering stuff, mainly to do with your brain, and yeah, and if you have stunts, you need aid too. There is no like cure, but there's a treatment for it, and it includes a lot of surgery, like spinal fusion, suprapubic cytoplasmy, the cesarean section, the medical procedures like binary diversion and enema. It can be prevented. It can't be completely prevented, but if you take folic acid during your pregnancy, it decreases the chance of your child having spinal bifida by 70%. You can, most people can have kids, but you should talk to your doctor first because of the risk of your child, or you're not fertile enough because one of your nerves is messed up. And there is no cure. You can't really cure the spinal defect unless you like go into their DNA and like fix it. So yeah.